This is USVI News, your Virgin Islands connection.
Hi everyone, thanks for joining us today for USVI News. I'm Emily Matson. We begin with details of a dire situation happening with our friends and neighbors in the British Virgin Islands. A huge spike in coronavirus cases is taking a toll there, with more than 17% of the population currently testing positive for COVID-19. As of Thursday, they are seeing 1,559 active cases. In comparison, the most active cases we've had here in the VI is 200, and we're 3 times the size of the BVI. Hospitals there are now overwhelmed as more than 100 hospital workers are affected by COVID or in quarantine. Thursday, VI Governor Albert Bryan Jr. said his administration is doing everything it can to help the BVI with resources and assistance. As the situation is now a crisis in the BVI, Bryan says residents here need to get vaccinated. Positive cases of the more contagious Delta variant have not been confirmed in the Virgin Islands, but it's very likely it's already here.
We will continue to do everything we can to give as much support as we can to the British Virgin Islands. Preliminary reports say that they expect their active cases to get to as high as 5,000. So it's going to get a lot worse before it gets better. So we have to make sure that we are taking care of not only them, but ourselves. What we want to make sure is that you are taking advantage of every opportunity to get vaccinated. You know, of all these people that are sick and people who have passed away, none of them have been vaccinated people.
Currently, 82,000 COVID-19 vaccine doses have been administered here in the territory, which means 58% of the eligible population has received at least 1 dose of the vaccine. Governor Bryan says effective Monday, if you travel from the BVI to the USVI, you will have to submit a negative COVID test within 48 hours of departure, and you should quarantine until you get that test back. And we're seeing a bit of a spike here in the USVI in COVID cases, but not nearly as bad as our British neighbors. Currently, there are 12 people hospitalized in St. Thomas and St. Croix fighting symptoms of COVID-19. There are currently 124 active cases in the territory. Positive case counts have risen over the past week. There are 57 cases in St. Croix, 63 in St. Thomas, and now 4 cases in St. John, according to the Virgin Islands Department of Health. The Virgin Islands Police Department have charged a St. Croix man with arson. 53-year-old Jose Crispin is charged with arson, attempted murder, domestic violence, along with several other charges. Around 3 o'clock in the morning on Thursday, VIPD detectives say they responded to a 911 call in the Concordia East area. Investigators arrested Crispin. They say he threatened his ex-girlfriend, then lit her apartment on fire. He's now sitting in prison under a $75,000 bond. An important notice to share with you right now about an issue in some sunscreens out there now. Johnson & Johnson is recalling some of its sunscreen brands after company testing identified low levels of benzene, which is a cancer-causing organic chemical compound. The voluntary recall includes all lots of 5 Neutrogena and Aveeno aerosol sunscreen products, that on the consumer level, that is. The only sunscreen products affected are the aerosol type products. So check your sunscreens there and make sure that you toss them out if you have them. Well, with the heat we see here in the Virgin Islands, the Red Cross is urging everyone to learn the signs of heat stroke, a condition which could be deadly. Mandy Gaither has the symptoms you should be looking out for.
As the sun continues to beat down on the U.S., millions have been under a heat alert this week. And in the West, record-breaking heat. The Red Cross says extreme heat is the most dangerous type of severe weather event in the U.S. To stay safe, stay hydrated.
You're going to be sweating a lot, so you need to be replenishing that water supply in your body.
During the heat of the day, take a break from the sun, wear light, loose clothing, and never keep animals or children alone in a hot car.
Temperatures could reach 120 degrees in a vehicle very quickly.
The Red Cross says to be on the lookout for signs of heat stroke, a serious medical condition caused by extreme heat which requires immediate emergency treatment. Symptoms include a high body temperature, 104 degrees or higher, hot, red, dry, or damp skin, a fast, strong pulse, headache, dizziness, nausea, confusion. The person may even pass out. If you suspect heat stroke, call 911 immediately. Move the person to a cooler place. Help lower their temperature with a cool bath or mist, or apply cool cloths to their body. The Red Cross also says not to give the person anything to drink.
Some good advice there. News across the Caribbean. The streets of Havana, Cuba are quiet following mass anti-government protests unlike anything seen there in years, 6 decades in fact. Cuba is blaming the protests on U.S. sanctions and Cuban Americans in instigating unrest on social media. Now, the White House is reviewing its Cuba policy right now, but the U.S. is warning Cubans not to come to the States. Ed Augustin reports from Havana.
Tense calm has descended on Havana, now in its 3rd day after unprecedented nationwide protests. These protests primarily motivated by deprivation for 2 main factors. First of all, the pandemic that has stripped the island of tourism and the $3 billion of revenue that the state normally gets because of that tourism, and also because of Trump sanctions that remain in place to this day. President Biden yet to rescind any of those more than 200 measures that were meted out against the island, and the result of that is playing out in Havana. Head of U.S. Homeland Security Alejandro Mayorkas, himself a Cuban American, said he had a simple message for Cubans who are thinking of braving the Florida Straits and making it to the United States. Do not come, you will be turned home.
Any migrant intercepted at sea, regardless of their nationality, will not be permitted to enter the United States.
In a way, this humanitarian crisis is forcing the Biden administration's hand. Is he going to prioritize those 60% or so Cuban American voters in South Florida that voted Trump, that do not want engagement, that do not want normalization? Or is he going to put human rights at the center of his foreign policy and allow the Cuban state to import the medicine, the fuel, and the food that 11.3 million Cubans so desperately need?
Meantime, the Cuban government is lifting customs restrictions on food, medicine, and hygiene products. Wednesday's announcement comes 3 days after those mass protests erupted across the island, driven in part by chronic shortages in stores. The new measure will stay in place for the rest of the year. Cuba's president has called protesters criminals, but he has also said the government needs to do more outreach and improve conditions in poor neighborhoods, which were rocked by those weekend protests.